Cancer will strike 1 in every 2 people in their lifetime, and in many cases it can be life-changing. So in this video, I'll offer my advice for exercising during and after treatment. Hi everyone, and welcome to Exercise for Health. I'm Richard, and today I have exercise advice for you if you have cancer or you've recently been through treatment for it. If you're new to this channel, we offer tips, advice and exercises to help you manage your health condition with physical activity. So go ahead and tap the subscribe button below and the bell icon if you want to be notified of when we upload a new video. There are more than 200 types of cancer, and due to the complexity of these conditions and the variety of treatments for them, this video will be very general in its approach to this topic. And depending on the comments I receive, I may end up doing follow-up videos of a more specific nature for certain cancer types such as breast, colon, lung and prostate, to name some of the more common ones. So first of all, research has shown that regular exercise and physical activity can help reduce the risk of cancer and secondary cancers, particularly colon, breast and cancer of the womb. In addition, moderate and vigorous physical activity is also deemed safe and helpful for many people with cancer. There is strong evidence that being active can help people with cancer reduce feelings of anxiety, improve quality of sleep, reduce fatigue and boost energy levels, improve fitness, strength and physical conditioning, reduce depression, prevent or improve lymphedema, which is a type of swelling caused by treatment to lymph nodes, and generally improve quality of life after cancer treatment. There may be times during or immediately after certain treatments that some types of exercise will need to be adapted or avoided for some people. Some examples of this are for people that have a low immunity following treatment, and they may need to avoid exercising in public places such as gyms with large numbers of people. People that have had bone cancer will be advised to avoid placing too much stress on the bones and joints, so may choose water-based activities as a safer alternative. People that have had surgery, such as a mastectomy of the breast, will need to take care with any arm movement or stress placed through the pectoral muscles, such as doing press-ups. And people that have had lymph nodes removed will need to strike a balance with the volume and intensity of the exercise they do to avoid an overloaded lymphatic system, especially for the muscles near the site of the removed lymph nodes. As a side note here, if you've had surgery to remove lymph nodes from your armpit, then you should wear your compression sleeve while exercising, if you've been given one, to reduce the risk of lymphedema. For all patients undergoing care for cancer though, it's important to get the individual advice from your oncologist or doctor as to what they would recommend for you in the initial stages. Over time, while in remission, you can then discuss with an exercise specialist what the most appropriate exercises for you are to get a tailored program to help you recover. Trying to be physically active during certain types of cancer treatments can be incredibly challenging. If you are currently having chemotherapy or radiotherapy, the side effects during these types of treatments can make you feel very poorly to the point that exercise may not even be on your radar. It's very important that if you are having these particular treatments, that the aim of any physical activity or exercise program is only to maintain your existing fitness levels. No progression should be attempted during these stages of treatment because the therapies are so aggressive, trying to improve your fitness can be detrimental to your health as it will exacerbate your symptoms of the adverse effects from the therapy. Therefore, remain as active as possible when you can, which can be something as simple as getting out for a 5-minute walk. If you really don't feel well enough to do anything on a day during your treatment, then don't, as your body is telling you it's trying to recover from it, and this may vary day to day. Some chemotherapy treatments are in cycles of 3 or 4 weeks, and it may be that there are only a few days within each cycle that you feel well enough to do some form of physical activity. So listen to your body, and just doing a little bit when you can will make you feel better mentally and physically. If you are undergoing hormonal or biological therapies, then you may not feel quite as poorly as some other treatment types, and you may find it easier to get into a habit of regular exercise. But again, only start when you feel ready, and begin by being conservative and not setting yourself unrealistic goals. However, as with all cancer types, the related fatigue and tiredness is likely to be the overriding factor in your exercise capacity. Don't expect a gradual improvement each week in your health and fitness, as there will be times when your exercise tolerance varies from day to day or week to week as you recover from the cancer and subsequent treatments. In terms of what you choose to do, make sure it's something that you can manage, but more importantly, something that you will enjoy, as this will help your adherence to it in the long term. Walking, cycling, swimming, or even gardening can all be great ways of improving your levels of physical activity without having to overexert yourself. Remember, the aim is for you to feel the benefit from the exercise so that you feel better. So if you're unsure, start with a small amount of it and then build it up if you can. Finally, don't view physical activity as having to be structured exercise during or immediately after treatment. Just trying to break up periods of rest throughout the day with short bouts of activities will be just as beneficial initially. A friend of mine who has recently completed his cancer treatment said that for him, just getting out every day for a short walk made a huge difference to how he was feeling, which aided his motivation for doing it. In addition, he said making sure that you speak to others about how you're feeling mentally and physically, especially with those that have undergone treatment themselves, will help you to stay positive. The one takeaway piece of advice from this video for people with cancer or recovering from it is to be as active as you can when you feel that you can. I hope the information and advice in this video has helped you today. If so, please give it a like by clicking the thumbs up button below to help this channel grow so more people can benefit from it. Thank you so much for watching, and remember to stay active, keep moving, and I'll see you next week. Thank you for watching. If you enjoyed this video today, please give it a thumbs up. You can also click here to subscribe to this channel or click here to watch a recent video. See you soon.